It is April the 9th, 2024. I hope everybody's having a wonderful day today. It has been a really busy day for me today. I've been running around all day today, and I am getting this recording done, and it is almost 6 o'clock. So that gives you an idea how behind I am today. So I'm just going to go ahead and jump into today's video. Today I want to talk about wet brain syndrome. And this is one of those things that is, one of the really scary parts about alcoholism and what it can lead to. I was listening to some stuff today because I already knew what I was going to talk about today. So I was actually listening to some shows talking about this, and it's rather frightening. I've had encephalopathy before. But from what I understand, encephalopathy is part of this, but it can, actually lead to a psychosis afterwards if it continues to go on, and it's rather frightening. But I'm gonna go ahead and jump right into this today and talk about it. So, what is wet brain? Wernicke-Korsakoff syndrome, or either WKS, also known as wet brain, is a serious and life-threatening brain disorder caused by an acute and prolonged deficiency of vitamin B1 or thiamine. Lack of thiamine can occur due to long-term heavy use of alcohol, dietary deficiencies, eating disorders, and chemotherapy. If left untreated, it can cause serious physical impairments. And the medical term for it is Wernicke-Korsakoff syndrome. Can wet brain cause dementia? And it can. So how much alcohol causes alcoholic dementia? And from what I've seen, according to recent studies, high-level alcohol consumption, which is considered to be more than 14 drinks or units per week, is associated with increased risk of dementia. Other factors such as poor diet can also lower thiamine levels and lead to worsened symptoms. Maintaining a balanced diet can help individuals at risk of developing wet brain to start to get enough thiamine to lower their chances of alcoholic dementia. However, the only way to fully avoid wet brain and alcoholic dementia is to lower the substance abuse itself. So what are the symptoms that come along with wet brain? Lack of energy, hypothermia, low blood pressure, coma, vision problems, abnormal eye movements, severe memory impairment, which can impact an individual's ability to form new memories that can cause memory loss, hallucinations, trouble with decision making, planning, organizing, or completing everyday tasks, lack of motivation, and emotional apathy. What is the main symptom of Korsakoff syndrome? And the main symptoms include confusion and memory problems. What are 5 signs of Korsakoff syndrome? And that would be loss of memory, making up stories known as confabulation, hallucinations, tremors, and disorientation. And what I was listening to today, they were actually talking about how people will actually start to make up stories when they have wet brain or Wernicke-Korsakoff syndrome, to the point to where they won't even realize that they're making up stories. One of the examples they were giving was that so you might ask somebody who has wet brain, what did you have for breakfast this morning? And they'll just come up with, and just say, oh, well, I had eggs and bacon for breakfast this morning. And the person might say, well, we don't even have bacon or eggs in the house. How did you have eggs and bacon for breakfast? And they'll just come up with a story and say, well, I had it in my backpack. Yeah, you didn't see it. And I just cooked up my breakfast this morning. So just very odd behavior that comes along with that. What does wet brain look like? A person with wet brain syndrome often experiences memory loss and may become forgetful or even seem confused and disoriented. Individuals with wet brain may also appear poorly nourished and experience weakness and decreased coordination. So not only can excessive drinking cause this as well, but also poor diet, the lack of the B1 and the thiamine. So, if you are, having problems with malnutrition, that can lead to it as well, which is another thing that comes along with liver disease. It is malnutrition. I've had malnutrition multiple times, or diagnosed with malnutrition. One of the problems is that you have such a hard time eating, especially if you have ascites, because you just feel so full all the time. And anytime that you put something else in your stomach, it just makes the bloating so much worse. It just makes things horrible. And I could see where, it could lead to this right here. So what does alcohol dementia look like? Alcohol abuse and alcohol addiction can be linked to various types of dementia, including Alzheimer's disease, vascular dementia, and Wernicke-Korsakoff syndrome. Different types of dementia may have different signs and symptoms, but can include memory loss, slowed speech, loss of muscle coordination, confusion, disorientation, impacted cognitive function, vision problems, and malnutrition. Is wet brain a disability? And wet brain can cause permanent memory loss and impacted cognitive function that can lead to permanent disability. So very, very scary stuff here. What is confabulation Wernicke-Korsakoff syndrome? Wet brain behavior can commonly involve confabulation. Confabulation, sometimes called honest lying, which I was just talking about just a minute ago, is a neuropsychiatric disorder in which an individual creates a false memory without intending to be deceitful. In Korsakoff syndrome, a person may have memories or recall experiences that never actually happened. However, they do not produce these false memories intentionally. Individuals with memory loss may tell these lies as a subconscious way of filling in memories and details that they don't remember. Wet brain stages. How long does it take to develop wet brain? The symptoms of WK syndrome can take a few days to weeks to develop. Wet brain typically develops in two separate stages, and this is what I was talking about at the beginning of this. The first stage of wet brain is Wernicke's encephalopathy, followed by Korsakoff psychosis. How long can you live with wet brain? Life expectancy for individuals living with wet brain can depend on a variety of different factors. If caught early, some of the short-term effects caused by excessive alcohol use that lead to wet brain can be reversed, and early detection can also help slow down the progression of this condition. According to studies, the median survival estimate of individuals with alcohol-related Wernicke-Korsakoff syndrome is 8 years. However, for individuals with other co-occurring disorders or health conditions related to alcohol abuse and who are in the later stages of alcoholism, the survival estimate can be much shorter and, in some cases, be as short as a few months. If you have a loved one who may be showing symptoms of wet brain, it is crucial to reach out for help and consult with a professional to get a proper diagnosis and guidance on the steps that you can take to get treatment. So what are the early signs of wet brain? Common side effects and symptoms of Wernicke's encephalopathy include mental confusion, loss of coordination, auditory hallucinations, apathy, and visual disturbances. Memory loss, mood changes, personality changes, and difficulty making choices. Does wet brain come on suddenly? The symptoms of wet brain could come on suddenly, taking a few days to develop, while in others, it may take weeks and take longer to develop over time. So what are the final stages of wet brain? Often when a person doesn't receive treatment for wet brain, Wernicke's disease can develop into Korsakoff psychosis. In this stage, serious memory loss and other damage to the brain can become permanent. In the final stages of wet brain, the ability to form new memories is often lost, and a person starts to progressively lose more memories. Unlike the early stages of wet brain, the effects in the final stages of wet brain are not reversible. So, the point is that if you think that you have a loved one, or you think that you might have something like this going on, definitely seek professional help, because some of the stuff can be reversed. One of the things that they were talking about in one of the shows I was listening to today is that they can actually give you a shot for the thiamine, and that can help reverse and from what I understand, it's rather expensive and very painful to get that shot. But it can help to reverse this. But you want to catch it early because it can lead further down and develop into the psychosis like we were talking about. So, wet brain can cause severe symptoms and unfortunately in some cases can result in coma or death. This is one reason why it's important to catch the signs and symptoms of Warnicki-Korsakoff syndrome early to help keep some symptoms from worsening or developing over time and becoming more serious. Wet brain deaths often result from Warnicki's encephalopathy progressing and being left untreated. So once again, if you think that you have a loved one or you think that you might have something like this, please go get it checked out so that it doesn't lead to one of these really bad consequences. And how serious is wet brain? Wet brain can progress and become a serious and in some cases life-threatening disorder. Excessive alcohol use and alcohol addiction can affect essentially every aspect of a person's life. It can affect the brain, heart, liver, and pancreas and put a person at higher risk of certain cancers, according to the National Institute on Alcohol Abuse and Alcoholism. Additionally, excessive alcohol use can cause mental health problems and affect a person's everyday life, responsibilities, and relationships. Alcohol addiction can lead to serious conditions, including wet brain, which can be life-threatening if it progresses. So, with that said, what are some treatments they can do for it? Well, how is wet brain diagnosed? If you have a loved one that may have wet brain, it's important to consult with a healthcare provider or a specialist, such as a psychiatrist, addiction psychiatrist, or a neurologist. A doctor may do different exams to rule out any other conditions or possible causes. However, wet brain is most often linked to alcohol use disorder, or AUD. WK syndrome is diagnosed by looking at an individual's history as well as symptoms present. If the presence of WK syndrome is suspected, they may confirm through a magnetic resonance imaging scan or an MRI. Certain exams may be done to check the damage to the nervous or muscular system, as well as exams to check a person's nutritional levels. Early detection and proper diagnosis of Warnicki's encephalopathy can allow for reversing some of the symptoms, which is why it's so important to reach out for help as soon as possible. Is wet brain commonly diagnosed? Researchers estimate that Warnicki-Korsakoff syndrome is undiagnosed in about 80% of patients. Wet brain is believed to occur in at least 1 to 2% of the general population in the United States. Individuals who chronically abuse alcohol are at a higher risk of developing wet brain. How is wet brain treated? Treatment for wet brain depends on the individual or what stage of wet brain they're in. Doctors typically treat Warnicki's syndrome with intravenous administration of vitamin B1 as well as glucose. Treatment for wet brain may also involve treating co-occurring conditions. In the later stages of wet brain, if a person develops Korsakoff psychosis, treatment may include vitamin B1, replacement therapy, oral supplements, and making sure the individual gets proper nutrition and hydration. It is important to remember that treatment for wet brain is not a one-size-fits-all treatment. One-size-fits-all. Treatment plans can depend on a variety of different factors, such as the individual's symptoms, the severity of their condition, and any other co-occurring conditions such as psychosis or psychiatric disorders. Some memory rehabilitation therapies, like ones used for other forms of dementia, can help a person manage their symptoms. However, those with more severe cases, residential care is needed. So, once again, if you let this go too far, you could possibly end up in like a nursing home because it can get that far. And you just don't want that to happen. And like it was saying, you can get treatment for it. You can get the B1 shots, getting the proper nutrition. They can do they can do an MRI and take a look at your brain. They can do a test and take a look at your vitamin levels in your body. And they can easily see if you have a vitamin B1 deficiency. And, it's rather simple for them to give you a shot and to bring those levels back up, and that they can treat it and keep it from progressing to the point to where you're not even going to know what's going on. And the last thing you want to do is end up in some kind of a home like that, because something like this that just went untreated, you definitely don't want to end up like that. So does wet brain show up on an MRI? And it does. Studies show that Wernicke's encephalopathy is most commonly seen on MRIs, affecting the thalamus, mammillary bodies. I'm not even going to try to even pronounce the rest of this. Some kind of gray matter, and collicular bodies. Can wet brain be cured? Wet brain is not believed to be curable. However, with early detection and treatment, some of the effects may be reversible. Treatment for wet brain can also slow down the rate at which this disorder progresses, helping individuals manage their symptoms and improve their quality of life. Receiving alcohol addiction treatment can seriously improve the future wellness of those who are at risk of developing wet brain from the effects of alcohol. So, once again, this is another one of those things that, comes along with, alcohol abuse or AUD. And it's very scary. I mean, you can basically, lose your memory. And I've had encephalopathy before, and I didn't even know I had it. I was really confused. I actually don't even remember the period of time that I had encephalopathy, because I just have no recollection of that period of time. I was in the hospital when it happened. I've had encephalopathy at home as well. I had no idea what was going on. I thought everything was fine, but my wife's the one that picked up on it. She could tell that I was confused. I wasn't making a lot of sense in what I was talking about. And one of the things that they did for me with the encephalopathy was, I took the lactulose and the Xifaxan to get the ammonia levels back down. But having the vitamin B1 or thiamine deficiency in your body can really lead to some problems. One of the problems is that with AUD is a lot of the times we don't eat for a lot of reasons. And one of the biggest reasons is that for anybody out there who is a big drinker, you guys know that when you have a full belly of food, the alcohol just doesn't absorb the same way it does when you have an empty stomach. And what ends up happening a lot of times, which happened to me, is I would start drinking on an empty stomach because I wanted to catch that quick buzz. And I would continue to drink on an empty stomach until I got so intoxicated I would just pass out. And I would go to sleep with nothing to eat. And there were days I would go for days without eating. And I was definitely malnutrition. And the thing about it is I was really overweight at the time as well. So, think about that for a second. I weighed 250 pounds, but I had malnutrition because I wasn't getting the proper vitamins and minerals that I needed in my body. And all of the weight that I had came from the excessive amount of calories that I was bringing into my body because of the alcohol and the mixer that I was mixing with it. And it's just horrible, the amount of things that this can cause. And the last thing that you want to do is lose your ability to think. Because, at the end of the day, I mean, you could lose, your ability to move around a whole lot. If you end up with ascites or something like that, like I was talking about yesterday, you might not be able to move around a whole lot, but you still have your mind. You can think. Just for instance, that anybody that ends up in jail, well, not everybody, but sometimes people end up in jail and they're like, well, they've locked me up physically, but they can't lock me up mentally. I still have my mental capacity, and I can read a book, and I can be in another place. But if you lose your ability to think and to put things together, that's just not a life that anybody wants to live. And I've seen people, people very close to me, who have lost their minds. And it's really sad to watch that happen to somebody, because they're just not there anymore. They're a shell of who they once were. And you just don't want to end up like that. So anyway, that's what wet brain is in a nutshell. I just wanted to talk about that today. And, once again, another reason why getting sober, not drinking, staying sober is so important. Just another thing to add to the list why excessive consumption of alcohol is just not a good idea. So just want to talk about that today, guys. I do, before I hop off of here, one of the subscribers sent me a box, and I just wanted to open it up and show you guys what she sent me today. It's one of the subscribers. Her name is Jackie. I'm not going to say her last name. And I have not opened this box up at all yet. So I'm going to open this up and let you guys see what she sent me. But I just want to do this because I just thought it'd be, you know, really neat to do on camera and let you guys see. Oh, wow. She lives in New Mexico, I think. So she sent me, I have never seen these before. Enchiladas. This must be some kind of like Spanish thing. This is so neat. Rindos. Guys, I've never seen any of these products before. This is really hot and salt. Oh, tamarind pulp candy. That is so cool. Watermelon, enchiladas or something. Oh wow, this is really neat. This is all like Mexican food. Milk caramel candy wafer. Oh, this, my kids are gonna be blown away by this stuff. Fideo. I've never seen this either. It looks like some kind of like little pastas. Durum wheat little pasta. I haven't. Oh wow, chamoy, mango chamoy. I've never tried this stuff before. This is so neat. This is like I've seen this before. I've never tried it, but they have like chopped mango and they'll serve it in a cup and they put like that seasoning on it. So I guess this is like a dried mango like that. Gloria's milk candy with pecans. This is so cool. This is all like this Mexican candies. Vera mango. This is so neat. I have definitely seen this. The Tajin. Oh wow. Green chili peanut brittle. This stuff is so cool. Guys, I'm telling you, Jackie, thank you so much for this. And David, you guys, I'm getting to try all these cool things. Thank you so much, y'all. Check this out. Green chili pecans. Red chili pecans. I love pecans too. Sweet and hot pecans. Wow, this is like such a treat right here. Green chilies. I know what I'm gonna be making here soon. Some enchiladas. Got some more green chilies here. Chili mango lemon. Here's another one of those milk caramel candy wafers. I've never seen these before, ever. A can of Rotel tomatoes. All I need is some Velveeta cheese and some chips. We're good to go. And some more chilies. That is just so neat. And she gave us a card as well, and I'm not gonna open this on camera, but I've got to say, Jackie, thank you so much, guys. This is so cool. She sent so much cool stuff. I'm really interested in trying this one right here. I love mangoes. I've never tried it with the spicy stuff before, but I gotta say, this is so neat. Thank you guys so much for sending this stuff to me. One thing, I love food and definitely love trying new stuff. It's one of the things I love doing is trying new things. So, Jackie, thank you so much for sending that. I really do appreciate it. And guys, thank you so much for watching today's video. I gotta say, this is just so neat, and my family are just gonna have a blast trying this out. So thank you so much. I really do appreciate it. And guys, I hope y'all have a wonderful day today. I have something, oh, that's a scar on my face. But I hope you guys have a wonderful day today. Thank you so much. Thank you for putting a smile on my face today, Jackie. You just made my day with that. And with that said, I will see you on tomorrow's video. Bye-bye.